So we have Luca's knee here. So from here we have the patella. So we can move it anteriorly and posteriorly, and then medially and laterally. And then from here we can have him slightly flex his knee. So we can find the median lateral joint 9 and move medially over this side and then laterally on this side. So we can't really feel it, but the medial meniscus and the lateral meniscus are located right here. And so these are the shock absorbers of the knee. So if we move medial and lateral more, we get to the medial shaft of the tibia. So right around here we have something called the MCL. And so this connects the femoral condyle to the tibial condyle and prevents valgus force. And then from the lateral side, we have another ligament band right there. So this is a little bit posterior compared to the MCL. So this connects the femoral condyle to the fibular head. So talking about the fibular head, we can move distal towards the phalanges of the foot. And so we have this bony prominence right here. And so this is a common attachment site for bicep femoris and also the IT band. So the IT band is a strong hip abductor, and it's usually quite tight on patients where it starts on the pelvis and then comes all the way down and then comes and attaches at this fibular head. And then so from that we can move medially towards the center of the knee, and then we have this other prominent bump right here. So this is the tibial tuberosity. So this is a common attachment site for all the quadriceps. And so from there we can move anteriorly towards the midline of the body, and then we're back at the median lateral joint line. So now if we both move anteriorly towards the center of the body and slightly on the medial side move more medial, and then on the lateral side move a little bit more lateral, right around here we have the we have the femoral condyles right here. And so then if we move to the center of the knee, anterior to the body, we have the quadriceps muscles, or start of the quadricep muscles. So this main one right here is the rectus femoris. It's the most superficial quadricep muscle on the center of the leg, and so it also attaches to the tibial tuberosity. And so deep to the rectus femoris we have the vastus intermedius, vastus medialis, and then vastus lateralis right here. And so these are all strong knee extensors. Okay, and then so back to starting of the midline, median lateral joint line of the knee. With my right hand, I'll move slightly medial and distal towards the phalanges. So right around here, this is a common attachment site for this is pes anserinus, and it's a common attachment site for sartorius, gracilis, and semitendinosus. So semitendinosus is part of the hamstring, so it's a strong hip extender. And then sartorius is a strong hip flexor and hip and knee flexor and lateral rotation of the hip. Okay, and then we have the gracilis, so it's a strong hip adductor. And then if we move slightly posteriorly behind, you can't really see it, but this is a common attachment site for the semimembranosus. So this attaches to the medial posterior aspect of the tibia. It's also a strong hip extender, and it lies deep to the semitendinosus. And then if we move back even more, I don't know if you can really see it, but back here is the popliteal fossa. So some muscles create the borders of the popliteal fossa. So we have the gastrocs, and then we have plantaris, we have semimembranosus, and then we have another muscle, which is the bicep femoris. And then I think that's it.